Hi, Mr. Walker. My name is Brian Cook. I'm a student physical therapist. I'm going to be working with you today.
Okay.
So my paperwork says that you've had Parkinson's for 3 years now.
Yes.
And how come you're coming in for physical therapy?
Well, I went to the doctor because I fell.
Fell.
Yeah.
How
And he
long-
said PT would help.
Mm-hmm. We're going to do the best we can to help you out. So with physical therapy, I'm just really trying to get you as functional as possible. So how did you fall? Did you lose your balance? Did you run into something?
Yeah. I was walking through a door. I was opening the door and I just fell, lost my balance.
Okay. Okay. Did you trip on something?
Right?
No.
I had one of those things where I couldn't lift my foot up.
Okay.
I fell.
Okay. So I'm guessing, and we'll check later, but with people who have Parkinson's, you can have something called freezing gait. And basically what that means is while you're walking, you have kind of like where it feels like it's stuck to the ground almost. Is that kind of what happened?
Yeah.
Okay. Well, we're going to address that, and even maybe in another visit, we can give you a questionnaire called a freezing gait questionnaire, and maybe we can progress from that. Okay. So is there any tasks that you were doing beforehand, hobbies that you're having difficulty with now?
I mean, a lot of things are just difficult to do because I'm slower, but mainly just getting around the house.
Just walking around?
Yeah, walking around, carrying things are hard for some reason.
Okay. Carrying with walking or just holding on to things?
Yeah, like I like to take my breakfast in bed, something I used to. I can't really do that now because I either fall or drop it or something.
Okay.
Yeah.
Okay. Yeah, I definitely want to get you back to helping you to care for your wife. That'd be a great thing. I think in the paperwork it also said that you had some balance issues.
Mm-hmm.
Okay. Okay. We'll try to address that as well. So, besides helping out with your wife, is there any other goals that you really want to get back to doing, like a hobby?
That's pretty much it.
That's pretty much it. Okay, that's great. Okay, are you taking any medication like levodopa?
Yes.
Yes. Okay. Do you know about the on-off phases?
Yeah.
Would explain that to you?
Yeah, they told me.
Okay. Just rehash it. On being when the medication's really working. When your fall happened, do you know if you were in that on phase or in an off time?
I'm not really sure.
Not really sure.
Yeah.
Okay. Do you think like with medication are you on right now or do you think you're off?
I'm on right now.
On right now. Okay. Well, that's great. Maybe we can address what you can do during the off times too. Like a lot of time when you wake up during the middle of the night, if the strength of your medicine has worn off, then it may be difficult to get out of bed. So maybe we can address that as well. Okay. Well, you want to get back to walking, carrying things while walking, and then your balance. So let's go ahead and move on to getting your heart rate and blood pressure and a few other things. Have you had any difficulty breathing? Like, you had a history of pneumonia, smoking, or anything like that?
No, I never smoked. No, not pneumonia.
Good, good. That's wonderful. Alright. So just relax. Have you noticed one side being more affected than the other?
Probably my left side.
Oh, your left side?
Yeah.
This side?
That's the one that started first, and then it went both sides.
Okay. Okay. Is it the same with your legs?
Mm-hmm.
Alright, well, let me take your blood pressure. Your heart rate. So just relax. Okay. Your heart rate is 58. That's actually very good. And your the rate at which you're breathing, it's 12, which is also awesome. Have you been working out aerobically, like Just walking a lot?
I used to.
Used to? Okay. Did you do the Ironman?
Nah,
No?
not that years.
Okay. I feel like you could have. Numbers like that. Okay. I'm gonna go ahead and take your blood pressure. Do you know what it normally is? No? Okay, that's okay. I'm gonna put this right here. It's nice and strong, but it's at 126 over 80. Is that about right?
I guess, I don't know.
Okay. That's a little bit high on the top end, but I'll keep an eye on it just in case. Okay. And I know that you said that you haven't had any difficulty breathing or anything, but a lot of times with progression, I'm sorry.
Well,
with-
I've never had smoking. I never smoked in long yet, but yeah, I do have like feel like sometimes I get short of breath. I'm walking a lot or something.
Okay. Well, I think I'm gonna go ahead and take a listen then,
Okay.
and then we'll move on from there. So every time you feel this touch you, I want you to just take a breath in and out of your mouth. Okay, just nice deep breath. You mind if I come down your shirt?
Sure.
Do you mind if I come up your shirt? Just feel a bit easier. Deep breath. Okay.
So you heard them, there's no repetitions, but it's decreased in amount.
Decrease in the bone.
You didn't hear it again.
Okay. Do I need to check the back? Are you able to lean forward without losing your balance?
Yeah, I think we
Okay. Check the back. Good. Good. Okay. Same thing? Alright. Okay. And I'm gonna go ahead and put this this gait belt on for both of our safety, and we're gonna practice a few breathing exercises. All right? I would do it over here, but we're a little bit close to the wall. And I want to make sure that you have enough room to move your arms. Okay. Is that too tight?
That's good.
Good, nice and snug?
Yeah.
Okay. Got sniffles?
Hip allergies.
Allergies. Yeah, my wife's got that really bad too. Okay. So, what I want you to do is just stand up as best you can.
Okay.
Okay. On the count of 3. 1, 2, 3. Okay. Are we able to come over here? I'm mentioning this. Okay. Don't sit down, just let me know a few things. Okay. Now when you come to sit back, I want you to try to feel the back of the desk, sorry, table on the back of your knees.
Okay.
And then just slowly try to bring yourself down. Good, good. Okay. And I'm noticing while you're right here, you kind of hunched over a little bit. That might be affecting your breathing. Okay? Okay, so what I want you to do is try to roll your hips forward and then bring it up, kind of like military stance, like come into attention. That's great. Yeah, I know it's kind of hard. Maybe not used to it, but this will allow you to take some deeper breaths. And I'm going to have my assistant come over here, Kelly. This is Kelly, my colleague. And Kelly, can you just sit in front? With your balance, I just want to cover all grounds. Okay, can you just make sure that he doesn't start moving too far forward? Okay. Alright. Now, Mr. Walker, can you come out like this, like taking a big, making a Y, a YMCA style? There we go. Come up and down. And this time when you come up, I want you to take a deep breath and look up toward the ceiling, okay? Breath, 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 breath. Slowly let it out. Make sure that chest is up. Up, 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 up. And down. Do this 3 more times. There you go. And down. Good, good. That's 5. Okay. Thank you, Killer. Okay. How you doing?
Good.
Doing all right?
Yeah.
Okay. Well, next I'm gonna check. Kelly, can you actually stay behind him just in case? Okay, for balance. And what I want to do now is work on. I would lower the bed more, but this is a little space. Okay. What I want you to do now is, are you able to move through this? Yeah. Can you come up? Good. Good. Okay. When you're leaning more forward like this with your rounded shoulders, sometimes I can make it to where you can't lift as high. So make sure you stay big, because it's not only good for your breathing, but it's also good for lifting things.
Okay.
Okay. Okay. The good biomechanics when you're carrying things to your wife and everything. Okay. So I'm gonna check out this. Increase tone, rigidity, both sides. Okay. I'm gonna check on this side. Okay. Cartwheel. Okay. That's noted. So patients with Parkinson's, they can easily get these rigid motions. It's kind of what I expected. So I'm going to check your lower extremity as well now. Sorry, your legs. Okay. Medical talk has got me caught up. Okay. Same thing noted on that. And cartwheel rigidity noted there as well. Okay. So can you make sure that he doesn't lose the fall forward as well, in case he does? Now, if you had a difficult time coughing at all, if you had a need to cough and you couldn't do it?
I haven't really noticed anything.
Okay. Can I hear you cough one time loud? Okay. That sounds pretty good. Okay. So we worked on the posture. Now what I want to do is try to use that posture to get into standing as well. Okay?
Okay.
So before we sit down, because this table doesn't go down any further, what I want you to try to do is, remember what I've taught you so far about your posture?
It's shoulders back, hips forward.
Shoulders back, hips forward. And now, since your feet aren't flat on the ground yet, I want you to try to maybe lift this side and come forward and scoot forward.
Yeah.
So lift up and push forward. There you go. Lift up, push forward. There you go. Does that feel a little bit better? Feel a little more stable?
Yeah, feet are on the ground now.
Yeah, there we go. All right. And now to do this, an easier way to getting up, rather, because I knew that it was kind of difficult over there, right? Okay. Well, a way that you can help yourself out is by getting some momentum. So maybe 1 swing, 2 swing, and on the 3rd swing, you use that momentum to push you up. Okay. But with that momentum, what I want you to do is be able to see your toes over your knees before you stand up.
Okay.
So have your nose over your toes.
Okay.
All right. So let's try that. And keep your chest up while we're doing this as well. All right. So on 3, we're going to stand up. Okay. 1, 2, 3. Stand up. That was so much better. That was so much better. Yes. It was. It was. Okay. Now, since you were having a little bit of difficulty with your balance, at least that sort of said on the paper, and you seem to be doing pretty well right now. I want to go ahead and take a measurement of just how many you bring your feet together. Okay. Good. And I'm going to time you for 30 seconds. Can you cross your arms in front of your chest? Good. I'm going to time you for 30 seconds. 28, 29, 30. Okay. And now this time, are you feeling okay? Tired at all?
No.
Okay. This time I'm going to have you close your eyes and do the same thing.
Okay.
Okay. 25, 28, okay, 30. Okay. All right, that was great. You actually did a lot better than I had assumed because of the paperwork. Actually, I think that we can go ahead and move on to the next thing. So, what I want you to do is we're going to come back over to this chair. Remember what I said about what are we going to do with the back of our knees?
Touch the chair with the back of my knee.
Touch the chair with the back of the knee. Reach back there with your hands. Lower yourself slowly. There you go. All right. Now, on the ground, forget about these little pieces of tape. Here, you see this tape right at your feet right here?
Mm-hmm.
And that's a piece of tape way over there. That's 10 feet. I want you to walk to that and back as quickly as you can, but as safely as possible, okay?
Okay.
And we're going to time you and then work on a few things after that.
Okay.
Okay? All right, so you stand up. Remember that 3 things of momentum. 1, 2,